Types of abdominal and pelvic incisions. Vertical incisions. Midline incision. Location, along the linea alba, from the xiphoid process to the pubis. Indications, general access to the abdominal cavity, often used in emergency surgery, e.g., trauma or exploratory laparotomy. Advantages, provides excellent exposure to all abdominal organs. Minimal damage to muscles. Disadvantages, can lead to a higher risk of wound dehiscence. Paramedian incision. Location, lateral to the midline, typically 2 to 3 centimeters to the left or right of the linea alba. Indications, used when the midline is not an option, such as in patients with previous surgeries or infections. Advantages, less risk of incisional hernia than midline incisions. Disadvantages, limited exposure to some abdominal structures. Coker, right subcostal, incision. Location, below the right costal margin, typically used for access to the liver and gallbladder. Indications, gallbladder surgery, cholecystectomy, or liver surgery. Advantages, provides excellent exposure to the right upper quadrant. Disadvantages, can compromise the diaphragm, requiring careful management of respiratory function post-surgery. Subcostal incision. Location, just below the ribs, usually bilaterally. Indications, often used for renal surgery or abdominal access through a flank approach. Advantages, good exposure for organ removal and less prone to hernia formation. Disadvantages, may affect the lower ribcage and musculature. Transverse incisions. Transverse muscle dividing incision. Location, across the abdomen, usually near the umbilicus. Indications, commonly used for cesarean section, C-section, certain pelvic surgeries, and some colorectal surgeries. Advantages, muscle fibers are divided rather than cut, leading to quicker recovery. Disadvantages, may have higher rates of wound dehiscence compared to vertical incisions. McBurney incision, appendectomy. Location, oblique incision in the right lower quadrant, around the McBurney point, 1/3 of the way from the anterior superior iliac spine to the umbilicus. Indications, appendectomy. Advantages, provides a direct and minimalistic approach to the appendix. Disadvantages, limited to appendicitis, less versatile. Oblique muscle cutting incision. Location, across the abdomen along the direction of the muscle fibers. Indications, access to deeper structures in the lower abdomen or pelvic cavity. Advantages, allows for easy manipulation of muscles. Disadvantages, can increase risk of hernia if muscle integrity is compromised. Phalansteal incision. Location, horizontal incision made just above the pubic symphysis, commonly used for gynecological and obstetric surgery. Indications, cesarean section and gynecological procedures. Advantages, cosmetic, lower risk of hernia, and minimal disruption to abdominal wall muscles. Disadvantages, limited exposure to upper abdominal organs. Maillard incision. Location, similar to the phalansteal, but with a deeper, more lateral extension. Indications, used for pelvic surgery, such as hysterectomy. Advantages, good exposure to the pelvic cavity. Disadvantages, more invasive compared to phalansteal. Thoracoabdominal incisions. Thoracoabdominal incision. Location, a combination of both abdominal and thoracic incisions, extending from the midline of the abdomen up into the thoracic cavity. Indications, surgery involving both the chest and abdomen, such as for esophageal surgery, diaphragmatic repair, or resection of tumors spanning both areas. Advantages, provides broad exposure to both thoracic and abdominal organs. Disadvantages, high risk of respiratory complications due to diaphragm involvement, longer recovery time.